Okay. Hello, everybody. Welcome back to our Facebook Live update here. Sunday, it's a little after 1. We're starting a little late. Our governor is finishing up his briefing as we speak right now. Certainly want to do our generic updates. Again, Commissioner Dan Weir is to my left, Emergency Management. Our Health Commissioner, Dr. Gupta. We have no confirmed cases of the COVID-19 virus in Onondaga County. The updates we have seen is there was no new cases in the immediate counties surrounding us either. So the data from that standpoint is consistent with yesterday. Certainly we want to talk about a couple things and reiterate a couple things. Our job in our planning and preparation for this has transitioned into mitigation, and we have done that in advance of a case. And on a daily basis, I'm getting a lot of feedback from many of you. Some of that is feedback saying we're not doing enough. Some of that is feedback saying we're doing too much. So I think we're in the middle of that. So I think we're probably right where we need to be. But we're doing the mitigation part of our strategy right now to stay ahead of the curve. And Dr. Gupta and her team and many other doctors in our community who are disease control experts working on guidance from CDC, but also their own experiences and their own craft, tell me and brief me about the time we have as a community to react once we have a case to flatten the curve. And we have 5 business days to essentially flatten the curve once we have a case. And so we are out in front of that right now to give ourselves more time. Time is our friend in this scenario, and we've done that. So certainly, if you have the ability to stay home and work from home, and certainly for our seniors, let's stay home, okay? Let's not push the envelope. For our seniors, if you're uncomfortable going to the grocery store, or you're uncomfortable with anything, please utilize your family members and your support systems. We're going to be putting out more information specifically for our seniors on if they are seeing issues, if they have food concerns, or if they have been trying to go to the grocery store, they can't find things. We're going to be putting out more communications moving forward on a hotline to help our seniors with this issue. I'm also happy to talk about kind of where we are with our strategies in flattening the curve. This is an evolving situation. Our teams are working around the clock, looking at data as it comes in, and then moving to the next phase of our strategy. And if you think of it, and there's a lot of parents who've been giving me feedback, if you think of it like a teeter-totter with your children on it, you always want to kind of have that balance, right? And as we're getting information, we have to balance the mitigation and what the right mitigation strategy is at that point. So we've talked about mass gathering and social distancing, and we've put policies in place. We then got out in front with a triage testing site that will be up and running tomorrow, and we'll talk about that. And now we have put forward our plan related to schools. And that is a very complicated plan, and there's many factors that go into that process, and we're going to talk about those factors. I know there's a lot of anxiety going on right now. I'm very, very happy that our phone bank for the triage line, the Upstate Medical University triage line, went up yesterday. We have had over 200 phone calls with individuals calling that in one day. And that line was going to be open 24/7 soon. And I'm very proud of the community for doing that, calling this, getting your questions answered, going through your symptoms, going through your scenarios before you show up at the emergency room. That's critical. So thank you for that. The alternative triage site, which will be doing testing, will be open tomorrow. Again, this is a big step for our community, getting ahead of the curve on this, okay? But there's rules. You don't just show up. You call the line, okay? If the medical professionals say you don't need a test, you're probably okay. If you have a primary care provider, you are calling your doctor and working out with your doctor if they believe you need testing. And most likely, your primary care provider will be able to give you that test at their office. If they say they can't because they don't have equipment, they can then probably refer you to the triage site for testing. But that will be a decision with you and your doctor. Your doctor knows you best, okay? So that's important. Certainly the Syracuse Community Health Center is that triage test site. Their team has been tremendous in making this happen in a week's time. All the hospitals are dedicating staff and resources. AMR Ambulance is a key partner in that as well. Our emergency management community and health department have been front and center. Again, those of you who are just tuning in today, and for those of you who are tuning in every day, this is kind of repetitive to a point, but it's important we go over this. Our emergency management team works on planning for emergencies all year round. Now we have one in front of us that they're plugging into their systems, their protocols, and certainly we're now starting to execute with knowing what exactly the challenge in front of the community is. There have been others. We've had commitments from nurses, from our school districts, because schools will be closed. That's critical. Any healthcare professionals that may be impacted and may have time over the next few weeks as we work to really flatten the curve and to preserve our medical infrastructure that can offer their services, please do. Please contact us. And you should be very proud of our community knowing that we are coming together in the face of this crisis, and we're working together in ways we just haven't done before. This is unique, but this exercise is going to make us so much stronger on the backside. Same thing with our message yesterday related the as far as the triage site. Again, the Upstate University Hospital COVID-19 public triage line. The number is 464-3979. And that is something, again, that we hear a lot about testing. I've got a lot of emails saying, Mr. County Executive, you need to do this because there hasn't been enough testing. In this county, when a doctor has said that this patient should be tested for COVID-19, nobody's being turned away. The whole notion of testing was companies being able to process the testing and having the ability to process the testing, not the ability of the doctors to actually perform the test. Okay, we are past that phase. People are being tested who are symptomatic of the flu-like symptoms, and that's it. If you're not sick, you're not getting a test. That may change in 3, 4, 5 weeks if the federal government and state government deem that appropriate. But right now, if you're symptomatic, call your doctor. Your doctor will tell you if you need a test. Okay? It's also important to note that this triage center at the Syracuse Community Health Center is not a walk-up clinic. You need to call in advance to set that up, because if you are symptomatic, they're probably going to arrange for you to park and potentially come out to do the test right then and there. Again, you need to call in advance and talk to them. The other part of our mitigation strategy that we implemented before certainly experts said it was necessary, and again, I had an email today saying, McMahon, the CDC says you shouldn't be shutting down schools until you have a case of COVID-19. Okay, yeah, they do. But what we've been looking at, then I'm getting emails on the other side. Remember our teeter-totter saying, shut down the schools, shut down the schools, shut down the schools. So we need to come to a balance, and that's where this plan is. And right now you're hearing the governor talk about the need for a balance statewide. And let me go through this specifically. I'm going to go through the plan, and I'm going to go through why this is critical, and it's critical that we continue to stay informed on the decision-making process, because as data comes in, we need to rebalance the teeter-totter. First off, as of yesterday, all non-essential school activities are canceled. That has already been implemented. If you are a parent and you are uncomfortable sending your child to school, it is a legal absence. It is a legal absence, okay? So if you are uncomfortable and you don't want to send your kids to school, you don't have to, okay? That's the balance we can come to. As of Friday at 4 o'clock, all school buildings will be shut down until April 14th. Okay, that's the executive order. In the event we receive data related to a COVID-19 positive case, we have already planned with our partners that schools will shut down Wednesday at 4 o'clock. Okay? Now, why aren't we just shutting down tomorrow? Okay? There are a couple things that are important. And I know you've seen other counties around, okay? Nassau County, they have over 50 cases. They have decided today that they're going to shut down schools tomorrow. They're working on that, okay? There's 50 cases there. We have no cases. Okay, so what are the decisions and what are the things we need to do before we shut down a complete sector in our economy and in our community? We need to make sure that the children, that their only meal a day that we know that we can guarantee is breakfast and lunch. Okay? We need to make sure that there is contingency plans in place and that we're comfortable with them because we have an obligation to children and county government. Okay? So we need the districts the ability to go out and prove, here's our continuity plan for feeding our kids and our nutrition plans while we are not in school. Your schools and your superintendents, some of them have already figured out the degree of their continuity of learning plans, what they're going to do with your kids when they're home for 2 weeks. Okay? So each district's going to be different. We've got that flexibilities for the district, but they need to plan this out. And certainly, we need our hospitals to implement their continuity of operation plans and our nursing homes and our first responders. We cannot shut down and have 20,000 or 25,000 kids all at home at once when you're going to, if an emergency happens, you're going to need an ambulance to come. If there's a fire, you're going to need a firefighter. If there is an incident where you need our sheriff's department or your police department, you're going to want them to show up, right? If they're all at home watching their kids, they're not going to show up, okay? So we cannot make a decision in a vacuum for one potential health crisis and create 10 other health crises at the same time. And certainly, we need to talk about our medical infrastructure. Folks, the reason why you're concerned about getting the kids home, many of you have said, I don't want my son or my daughter, I have my parent is elderly, they have this issue, this autoimmune issue, they just had chemotherapy. I don't want them to be there and they could spread it to my loved ones. Okay, so you're worried about a community spread. Many of you are teachers concerned about going into school this week. Okay, I understand your anxiety. Okay, we can't let the anxiety win in this case. The data shows we don't have a case. Okay, my wife is an educator. I have 3 children. We're in 3 different buildings every day. Okay, I have this same anxiety, but the data needs to drive the process. But what we don't want to have happen is make a decision that is convenient for my email today, and then in 2 weeks, when we're dealing with a potential community spread, not have the same people working at the hospitals that you need your parent or loved one to be served by. We cannot have our medical infrastructure broken down based off of convenience, okay? And we've talked to our superintendents about this, and we have said, if you can show us the plans, you can show us the child care plans, you can show us the continuity plans related to nutrition, our hospitals are okay with their continuity of operations and all our medical team, we can talk about moving the date up from Friday, but we cannot create other crises out of anxiety and fear. And that's letting this situation win and get the best of us. And so that is how we come together. And so the Center for Disease Control, the infectious disease experts, our Dr. Gupta and her team, they're watching all of this. And we're getting ahead on the mitigation curve because there's still a lot of respiratory illness right now, and it should be going down. So the reason why we're coming forward with this is because we're getting ahead of it right now, but we can't get so far ahead of it that the whole system collapses when we need it to perform well. So that's kind of something I just think we really need to think about. And I know I'm emailing you, as many of you back as I can personally, to let you know I hear you, but this is bigger. You're going to need it. Your neighbors are going to need this medical infrastructure in place in weeks, if not days. And we can't make a decision now that's easy and to say yes to people who are feeling this anxiety. We have to let the data drive the decisions. And if the data changes and we need to rebalance the teeter-totter, we will move up the timeline with school closings. Okay? So a couple other things on a little humor note. I don't want to be the first county executive that has to issue an executive order related to toilet paper. Let's take care of our neighbors. Let's not create anxiety in supermarkets with shopping carts. It's really interesting to see some of the community's buying patterns and some of the things that are off on the shelves. We should have some, we can laugh about that, but in all seriousness, this creates anxiety. And everybody goes to the grocery store. And then our seniors who aren't comfortable being in crowded places right now, they're not comfortable going. And when they go, nothing's there. Folks, the grocery stores are going to be open. You're going to be able to get materials. Let's be smart. Have a little stockpile, but let's not go crazy. Okay? Now's the time for us to come together and help our neighbors, look out for our seniors, be smart. Our loved ones who happen to be seniors, let's take care of them. Let's make sure that they're practicing good social distancing. And there will be more and more talked about over the next few days about social distancing, and if there's new rules and regulations coming into effect, either at the state level or the local level, based off of the data that we're receiving daily from our medical professionals. A couple other things related to this. I want to specifically thank the state and the governor for his leadership on this. The governor is going through a lot right now in other parts of the state. It's ground zero. So I want to thank him for his diligence, certainly on this. Our federal partners. I specifically want to thank John Cacco, our congressman, for supporting a stimulus bill that was just passed the House. Senator Schumer, I want to specifically thank Senator Schumer. This bill that the senator worked very hard in will provide local dollars to counties. Why that's very important is we have to keep all this costs money. And at the same time we're making decisions to shut things down, that means we're losing money. Right? Those businesses are feeling pain, but your government's feeling pain because we run government on sales tax. So that federal bill that Congressman Cacco voted for and Senator Schumer really helped craft will provide needed funds to counties and to the state so that we can continue to do our job to fight this coronavirus and be proactive, but also will help us with the lost revenue that we're realizing at the same time. Saying that, I want to bring in Dr. Gupta to see if Dr. Gupta has anything to offer.
So a couple of things, just a reminder, as County Executive has mentioned about the alternate triage site and testing. I think it's important for people to remember when the test is being ordered that they cannot just go out grocery shopping after that. They really need to self-quarantine until they know that final result is negative. If there is a concern enough that your doctor thinks you may have COVID-19, it's important that you are following all the recommendation and do really remain in the house self-quarantine until you know the test is negative. The other thing is make sure I'm asking my physician colleague, there are more and more training are being provided by the health systems. Please make sure whichever health systems you are connected with you are connected with them. Make sure you are engaged with them and listen to those webinars because they are being provided in a regular manner. And if those physicians who don't have that connectivity, feel free to contact Medical Society and us, then we will put something together for you together to make sure that you have all the resources in terms of making judgment call, triaging your patients. We have continued to update our website, so please visit our Onondaga County Health Department website, go to the coronavirus page, and there is information about the hotline as well as the updated guidance, which will continue to change. probably next few days from the state, it's there. So your help is very important because you are the primary care physician. If they are calling you, please make sure continue to give them good counsel, because you have that connectivity which no one does. This is the time of need for your patients. Please be there for them, and I thank you for being there for them at this time of the need. And last is that for the seniors, those who are kind of very limited in this one in their capacity, those who have underlying problems, I am asking families and friends, make sure that check on them, look for their needs, make their phone calls, and be there to help and support, provide that information. So thank you.
So a couple things before I turn it over to Commissioner Weirs, just to recap. One, this week we're going to be coming out with a senior support line that seniors can call if they're having issues. Two, we have changed our operation plan from plan and preparedness to mitigation. Even though we don't have a case yet, getting in front of this, way in front of this. Mass gathering policies have been implemented. The triage site for testing has been implemented. We have a plan that we've been giving for a school closure timeline that has been done. And now the next part of that, we yesterday I declared a state of emergency, which gave me the ability to set that timeline for schools. It also gives us the ability to do things for purchasing that we need as we have a crisis in front of us. We need the ability to go purchase things and do different things that normally require bureaucratic red tape. That red tape is gone. But one of the things we're doing tomorrow is we're opening the Emergency Operations Center in county government. And Commissioner Weirs, why don't you talk a little bit about what that means and why that provides value to us?
Thank you. As the county executive said, this situation is evolving and changing on a regular basis, and we've been doing a lot of work to help coordinate with all of the different partners in this and in our response efforts. Establishing the center will give us a dedicated location throughout the day to have people dedicated to working on this and kind of stepping up our collaboration and our coordination. It will also help us with resource management. As we all know, there's some resource needs throughout the community with our partners, and this will be a facility where we can work on those resource needs, whether it's through the purchasing process, also with the distribution of those to our partner agencies in efforts to help get them what they need to respond. So again, as this evolves, we're evolving. This just adds another layer of that to us, another growth in our response efforts, and that we'll be able to have these folks together throughout the day.
Thank you, Commissioner. So in closing, a couple thoughts, okay? And the anxiety is real, and we feel it every day. And part of our public health is our mental health, okay? So it's a great day. Go take a walk, first off, okay? I challenge you. I challenge my employees to take the steps at work sometimes. Go take a walk. It's a beautiful, crisp day outside to help you deal with this. Second off, everything we're doing, it's not just me saying, I think this is a good idea, let's do it. That's not how these things work, okay? I have people in medical professionals with Dr. Gupta, and Dr. Gupta has people she talks to that are experts in specific areas, and we come up with informed decisions and informed planning. And then once the data is in front of us, we make a decision on how we're going to balance that teeter-totter that day. And that's how it happens. So I know it's tough, and I know you feel it, and I know you're scared. But our number one interest is not anything but the safety of you and your families. And you have to believe that. That's our number one interest. Every decision we're making is around that. And there's a lot of pressure to do different things on all sides of this issue. And you have to know that we're doing everything based off of data, right? The data is the data. There's no bias in the data. And based off of the experiences of experts who have dealt with crises similar to this before. These decisions aren't being made in a vacuum. So please stay informed. Go to ongov.net, our health department. Take care of your neighbors. Continue to check into this daily briefing that we are doing. If anything changes related to a confirmed case, or a material change in policy, we'll probably do one of these, but also do a press conference. But we are looking at all of these issues, and we're moving now on full mitigation strategies at this point, even though we don't have a case. So take care of your neighbors. We'll be stronger on the other side of this, and thank you for your time.